Welcome back to Dental Chat. Today, we're taking a look into the fascinating world of local anaesthetics. Today, we're going to explore how these crucial drugs work so as to make dental procedures as pain-free as possible. First, let's start with a brief history. It seems incomprehensible to us now, but not so long ago, humans had no effective way to make a particular area of the body unresponsive to pain. And so you can only imagine how terrifying it must have been to have undergone any surgery. The journey of local anesthetics actually began in the 19th century with the isolation of cocaine from coca leaves in 1860. Now, cocaine was the first local anesthetic used in medical practice, but unfortunately, its addictive properties led to the search for safer alternatives. In 1905, so really just over a century ago, procaine was synthesized, which was commonly known as Novocaine. Now, this marked the beginning of modern local anesthetics. Today, we use a variety of local anesthetics, including lignocaine, which was synthesized in 1943, and more recently, articaine, introduced into Europe in 1976, the United States in 2000, and Australia in 2005. Now, let's remind ourselves how an action potential is formed in a nerve cell. Cells have a bilipid membrane, basically a fatty membrane which controls the entry and exit of substances, maintaining the cell's internal environment. In a nerve cell, there is a resting membrane potential between the outside and inside of the cell of about minus 70 millivolts. So what can and what can't pass through this membrane? Basically, lipophilic molecules, which means that they are fat-soluble molecules, can easily dissolve in the lipid part of the bilayer and can pass through it. Also, very small, uncharged molecules can pass through as well. However, charged molecules like sodium, potassium, or chloride ions can't pass through the lipid membrane as they don't like mixing with fat. Also, large molecules like glucose and proteins can't pass through. So to summarize this, it can be said that large and charged are barred from passing through the membrane. Therefore, ions need to pass through special channels in the membrane, such as the sodium channel, which allows them to avoid the fatty membrane. Now, when a stimulus is strong enough, sodium ion channels open, allowing sodium ions to flow into the neuron. This influx of positive ions makes the inside of the cell less negative, reaching a threshold potential of around minus 55 millivolts. Once this threshold is reached, the membrane is depolarized and an action potential is triggered, propagating an electrical signal along the neuron. Now, what if there was a way to stop the sodium ions entering the inside of the cell? Well, of course, there is local anesthetics. So let's deposit some local anesthetic into the extracellular fluid of the tissue near the nerve. Now remember, when local anesthetics are stored in cartridges, they are typically in a charged or ionized form. This is often the hydrochloride salt form, which makes the anesthetic water soluble and stable for injection. Now, what happens is that the LA in the tissues will reach an equilibrium between its charged and uncharged forms, and the ratio will depend on the pH of the tissues that it is injected into, which is normally around 7.4 in body tissues. Remember, the charged forms can't pass through the lipid bilayer of the cell membrane. However, the uncharged form of the local anesthetic is lipophilic and can diffuse across. Once inside the nerve cell, the equilibrium shifts again due to the intracellular pH, and some of the uncharged molecules can reionize. Now, this charged form then binds to specific sites on the sodium channel, which are accessible only from inside the cell. When the molecules bind to these sites, they cause a conformational change in the sodium channel protein, which prevents the sodium ions from entering the nerve, which in turn prevents the depolarization of the nerve cell membrane, which is necessary for the propagation of an action potential. Without the influx of sodium ions, the action potential cannot occur, and thus the nerve cannot transmit pain signals to the brain. So depolarization does not occur. So let's finish off by looking at how the presence of infection at the injection site affects this process. Infected tissues have a lower pH, which means they are more acidic than healthy tissues. The pH of infected tissue can drop from the normal physiological pH of around 7.4 to as low as 5 to 6. In a more acidic environment, there are more hydrogen ions available. So now let's inject into this tissue and see what happens. Now, because, as mentioned, there are more hydrogen ions already available in this area, this shifts the equilibrium towards the ionized form, which means that a higher proportion of the anesthetic will be in the charged form. And you will recall that only the uncharged form of the local anesthetic can easily diffuse across the lipid bilayer of the nerve cell membrane. In an acidic environment, since more of the anesthetic is in the ionized form, less of it is available in the uncharged form to penetrate the nerve cell membrane, and thus less of the drug can enter the nerve cells. As a result, the concentration of local anesthetic inside the nerve cell is lower, leading to insufficient blocking of the sodium channels. This results in a reduced or delayed onset of anesthesia, or in some cases, failure to achieve adequate anesthesia. That is one of the reasons we don't inject into infected sites. So there you go. Whilst this has been a simplified explanation of how LA works, I hope it helps explain it to you. Thank you for joining us. Remember to like, subscribe and share if you enjoyed this video, as that helps us to make more of these available. Ask any questions in the comments below. I'll catch you next time. Thanks.